Your smart speaker.
And on BBC Sounds.
BBC Radio Scotland.
12:36 now. You're listening to Lunchtime Live. Today with Lucy White. I'm here with you until 1:30. The Scottish Government is still failing to meet its target for children and young people getting mental health treatment. Figures for between April and June this year show 84% began treatment within 18 weeks of referral. The standard set by ministers is 90%. But the number on the waiting list is down compared to the same time last year. Claire Henderson from Glasgow saw her own health deteriorate as she tried to get help for her daughter. She got support from the charity Parenting Mental Health, which was founded by Suzanne Alderson. Both Claire and Suzanne are with me now. Good afternoon.
Afternoon.
Hi
Good
there.
afternoon.
Claire, you were helping your little girl and she was quite young when she started to show signs that she was struggling. Tell us about that.
Yeah, so my daughter started to show signs after her grandmother's death when she was 4 years old. That seemed to be a major trigger for her. And the signs in school and her saying that she wanted to kill herself started from around age 8 or 9. And obviously as a parent, I was extremely stressed and worried about these symptoms and behaviours and feelings that she was having and didn't really know where to turn to.
And what did you end up doing to try to get help? What avenues did you pursue?
So I was able to, I'm an occupational therapist, was at that time working for NHS Lanarkshire. So I was aware of how referrals into the health system worked and prioritisation and wait lists. So I had an advantage. And unfortunately, I was on the wait list for a long time, waiting for CAMHS involvements, and, you know, referrals had been made by the GP and things. And the situation was getting more and more desperate for me and my daughter, and she was becoming more and more isolated, unable to get up and out of her room. Everything was just too overwhelming for her, and I was in a really desperate situation.
And did you eventually get that help, help through the...
Yes. Yeah. So eventually the CAMHS, I was able to get her prioritised when she was suicidal and, had suicidal ideation, and she was self-harming, cutting herself and developing irregular eating behaviours as well. So it was disordered eating as well. So I was really desperate to try and get her some help before anything escalated further.
And you waited some time for that as well. And Suzanne, your charity was part of helping out Claire and her family. Tell us about what it is that you do.
Well, Claire's experiences mirror so many of the parents that we support at Parenting Mental Health, including myself, because I had a very similar experience, which led me to start, first of all, a community on Facebook in 2016, about a year after my daughter first attempted suicide. And then we became a charity in 2020, and we now support around 50,000 parents. And it's not just around the isolation or reducing that isolation, which is an absolutely key part of what we do. It's also about allowing parents to understand that this isn't their fault, they're not to blame, but there are things that they can do to support their family. And it really starts with them taking care of themselves, and also really reframing how they look at this really challenging situation. And we know from the report that we've released today that it touches every part of a parent's life. It's not simply about the child themselves. It impacts on relationships, on your ability to work, on your own mental health and your own physical health. And so it's really important. I'm really grateful to you for highlighting this today, because these families are often invisible. The challenges go unseen, unheard and unsupported, aside from hopefully the work that we do at Parenting Mental Health, because there's such a stigma and such a lot of shame around having a child who doesn't want to live, or who's struggling with depression, or simply can't go to school. So it's so important that we continue to have safe spaces where parents can come without any judgment and get the kind of support that they need.
And Suzanne, we're talking to you today because we've had the latest figures from the Children and Young People Mental Health Services saying that the government isn't quite reaching its target of 90% of them being seen within 18 weeks, but we are seeing waiting lists coming down. What's your experience of those kind of services and the way that they interact with the families that you help?
Well, I think the numbers are, there's some other stories underneath the numbers. We've seen huge increases in parents looking for private diagnoses because the waiting lists are just too long. And so I wonder whether an influence on those numbers is the fact that parents are now feeling that they have no option but to go privately to get a diagnosis or some form of psychological support. But I also think that there are pockets of good news. We've recently spoken to CAMHS in the Glasgow area who are looking at the impact that parents can have. And if we positively support parents, they can actually make a huge impact in their child's mental health. Again, this isn't about blaming or shaming. It's about saying if we properly support the whole family, then hopefully we can not just make this a medical challenge, but we can look at it in the relational through the relational lens that we need to.
And just to say, the Scottish Government have said that they're investing an additional £55.5 million in funding for CAMHS in the year 23-24. Before we go, and we'll have to wrap it up, unfortunately, but Claire, how is your little girl doing now, and how are you doing now?
Well, thankfully, due to the bursary that Suzanne enabled me to go on a partnering, not parenting, online program, and I've been on that twice now. It reframes your whole perspective on your child's well-being, and the most important thing that it does, as well as supporting you to develop a framework to understand what's going on, it also reminds parents how important it is, and when you're alone and when you're lost and you're not sure what to do to help your child and you've tried everything, parenting mental health is absolutely the place to go to get advice. And Suzanne and the team of moderators and the courses and the books that are available is absolutely invaluable.
Made a big difference. Listen, thank you both very much for taking the time to speak to us today. Really good to talk to you both. Claire Henderson there from Glasgow, a mum, and also Suzanne Alderson, who's the founder of the charity Parenting Mental Health. Now, council strikes over pay could be back on. The biggest council union, Unison, has rejected an offer made last month to try to see off the threat of bin strikes. Let's speak to our news correspondent, Jamie McIver. Jamie, why have they rejected the offer?
I suppose in a nutshell, Lucy, it's as simple as this. The offer was not good enough to satisfy Unison members. Now, one particular concern of Unison is that the union thinks more needs to be done to restore the value of council pay, which it says has fallen over the years. Now, this is the offer which Unison members turned down, a rise of either 3.6% or almost £1,300 a year, whichever is the higher. And for the lowest paid in particular, that was a big improvement and what was previously on the table. Unison will decide in the next few days what should happen next. Now, the union has got a mandate for strikes by refuse and recycling workers in 13 council areas and by staff in schools and early years in 5. But remember too, there are 2 other significant council unions, the GMB, which has accepted the offer, and Unite, which is likely to accept the offer. So any action which Unison may call won't be as widespread across Scotland as a whole as the strikes which came so close last month would have been.
So is there any chance of a better pay offer?
Certainly going to be very hard for councils, Lucy. They say they've got no more money. And the offer Unison rejected was only made possible after the Scottish Government got involved and made more money available for pay. Now, fundamentally, more for council workers or any other group of public sector workers for that matter will mean less in the budget for something else. Now, the council body COSLA says it's deeply disappointed by Unison's decision, and it's urging Unison to reconsider